I'm barely able to even make it to the bathroom because walking is so difficult. And once I get there, I'm at the point where it's getting hard to fit through the door.
Oh, wow.
It's been a long time since I could stand in the shower, like 12 years. I've had to go from bathing every day to about every 4 days because I have to work so hard to do it.
It is so difficult for her to bathe that she can only literally do it once every 4 days. These are called activities of daily living. And when you are unable to perform these activities of daily living, then something definitely needs to change.
Food has been the greatest source of comfort in my life as far back as I can remember. But I remember my weight gain really started when I was 5 or 6, about the time my parents were divorced. And I was already around 150 pounds when I was 7.
Adverse childhood experiences, otherwise known as ACEs, are basically traumatic events that can occur during a person's childhood. And studies show that children who undergo a lot of adverse childhood experiences have a much higher risk of eating disorders, and specifically binge eating disorders. And there was a study that did show a correlation between parents getting divorced when you're a child and eating disorders as well.
So it was like this negative cycle that got worse when I got into high school, because I got up to about 400 pounds before I dropped out of school when I was 17.
So traumatic childhood experiences do have a correlation with binge eating disorders and other types of eating disorders like anorexia and bulimia. But we don't really know exactly why those are connected in the ways that they are. But we do know that people who have binge eating disorder, and we'll see if this is what she has, do have the highest rates of ACEs in their history.
In order to make money, I chose to start fetish modeling. So I have a setup in my apartment where I can film myself eating, and I eat for people.
Well, this is a new one for me. I am not a big fan of watching other people eat, and especially ASMRs where people are eating and you're listening to their mouth make all of these sounds. I mean, it just, honestly, it kind of grosses me out. But apparently there is kind of this niche of people wanting to pay money, I guess, to watch people eat food and listen to them. I don't get it.
I just eat what I want, and they pay for it, as long as I film it. So that's how I make a living and keep going. And it makes me feel appreciated. So I'm happy to do it.
Well, you have to hand it to her that she has found a very novel way to make a living, being the size that she is and unable to do other types of jobs. Now, I'd love to hear from you in the comments. Do you like watching people eat? Do you like to listen to these sounds of people's mouths chewing and gurgling and snapping and all that type of stuff? I mean, it so grosses me out, but let me know what you think in the comments.
Thanks, Samantha.
Hi. Skin has been a big problem right now. My right side is bigger. It's so full of fluid that the pores are themselves are just weeping fluid.
So why is she saying that her pores are weeping fluid if she's basically overweight? Well, it does sound like she has lymphedema. And lymphedema is a condition where you can get backflow of the lymph vessels. Now, lymphatic fluid basically is protein-rich fluid that goes through its own kind of channels through the body. And this is also where immune cells basically go through that are separate from our actual blood vessels. In certain conditions, this lymph fluid can kind of build up in certain parts of the body and cause that area to swell up. In extreme cases, you can get elephantiasis, where you can get actually large masses of the body just filled with fluid, and that fluid can just seep out even through the skin. Now, this can occur in people who are exceedingly overweight, like in Samantha's situation, where the actual weight will cause those lymph channels not to be able to move fluid. In developing countries, lymphedema is most commonly caused by parasites. You can actually get worms that will basically go into those lymph channels and will clog them up, causing parts of the body to swell excessively. And you may have seen photos of people from developing countries where they can have, let's say, a huge leg because that leg's lymph channels have been clogged up, literally by worms.
So they just recently put me on a 2,100 calorie a day diet.
But you're still eating around 10 to 12,000 calories a day.
She is in the hospital and she's eating 10 to 12,000 calories a day. I mean, the first question is, how does she get so much food while she's in the hospital? And 10 to 12,000 calories, that is literally 10 Big Mac meals every single day. That is a ton of food. Would you like to look 5 or 10 years younger, but you don't want to go under the knife or needle? Well, what if I told you that you could use your body's own natural regenerative abilities to turn back the clock in a major way? Yes, it's a process called autojuvenation, and it's the culmination of 20 years of me being a holistic plastic surgeon. I reveal this groundbreaking approach in my new book, Younger for Life. In this step-by-step guide, I show you how, through simple changes in diet, activity, and skincare, you can reap huge changes in your skin and look younger than ever before. I teach you how to reverse the aging process by combining intermittent fasting with autojuvenation promoting foods. A simple skincare routine that can keep your skin looking young and healthy for the rest of your life. Best practices for sleep, exercise, luxurious thick hair, beautiful teeth, and mindset. Everything you wanted to know about non-surgical treatments like Botox, fillers, red light treatments, and much more. And a simple 3-week program to jumpstart your autojuvenation process to look and feel amazing. This is the book other plastic surgeons don't want you to believe because it will keep you out of their offices. Check it out at autojuvenation.com and receive a ton of free gifts, including a $30 gift certificate for skincare and supplements, a companion recipe book, and much more. Why wait to turn back the clock? Please order Younger for Life at autojuvenation.com. The link is in the caption below.
You'll lose 10 to 50 pounds over the next 2 months. This is going to be very easy if you stick with the 1,200 calorie diet, okay?
Okay.
One of the things that Dr. Now often does with his patients is he puts them on a lower calorie diet and really gives them a short-term challenge to see if they can get themselves to lose a little bit of weight before he considers doing major surgery. Although a lot of people think that bariatric surgery is a cure-all for weight loss, it really is not. And if you're not in the right mind and you're not willing to change your lifestyle and your eating patterns, you can eat through bariatric surgery. Yes, you can take a stomach that, let's say, has been reduced down the size of a golf ball in the case of a gastric bypass, and you can eat enough gradually that you can expand that stomach almost back to regular size for some patients. And so to put a patient through a short-term challenge like this really helps Dr. Now to determine, is it worthwhile going through this huge invasive operation? Are they going to be successful, or do you need to make some changes in their life first before you actually make those big decisions to have surgery?
Today I'm home after being in the hospital for a while. The positive thing is that I'm able to order anything that I need or want, or like, it's comforting to me.
Oh no, this does not sound good. Maybe she's gonna order a reasonable amount of food from takeout. Let's see.
I would like chicken strips, 4 orders of street corn, just house barbecue flavor ribs, mushroom Swiss burger, fries, strawberry lemonade, and then a molten chocolate lava cake.
That was just her order. So unfortunately, Samantha does not appear to be doing very well with restricting her diet to try to get herself healthier and lose weight. What's going to happen next? I mean, this is not a good situation for her at all. So to make matters worse, there's a global pandemic that involves your lungs, and she's stuck in the hospital. Now, keeping her in the hospital and isolated, hopefully, was probably a really good thing, because if Samantha got COVID-19 back then, especially that Alpha or that Delta variant, and it went to her lungs, which it obviously did in the vast majority of patients, that probably would have killed her. And so the fact that it sounds like maybe they quarantined her and hopefully prevented her from getting COVID-19, that probably saved her life. Typically, gastric sleeve operations are performed after a patient has made major changes to their diet and their lifestyle to be able to be successful after this operation. Because like I mentioned earlier, you can eat through a bariatric surgery. Now, during a gastric sleeve surgery, you literally will remove or cut out a portion of the stomach, reducing the size of the stomach to about the size of a banana. And because of this, you get full quicker, and then you therefore eat less food and hopefully lose a significant amount of weight. I have never really heard of it being used in an emergency situation like this, where somebody literally just can't stop eating and people can't stop giving her excessive amounts of food, and then you use this operation basically to save her life. In an acute situation, this is the first I've heard of this. So I really hope this works for Samantha, because unfortunately she didn't get on that right track before having the operation. They just had to go in and do it to save her life.
These past months have been a huge change for me because getting weight loss surgery saved my life. Because I'm down to 638 as of this morning.
Well, that's really good news. I mean, normally if somebody says, hey, I weigh 638 pounds, you think, oh, wow, like that's so high, and she's, so unhealthy from all that added weight. But to lose 300 pounds and get down there, I mean, that's just a huge accomplishment. And I hope that this is just a first big step for Samantha.
Samantha is doing really well. She's down to 640 pounds as of yesterday. And she's really motivated. She's doing PT and not fighting that at all.
So from what her doctor is saying, it sounds like mentally she may be in the right space, which is so important for her success.
After my most recent surgery, the wounds refused to heal, and so I was sent to a rehab facility, and this is where I'm at right now. It's a small setback, but by this time next year, I will have my life back.
So it sounds like Samantha is on the right track to hopefully living a long, healthy, and fulfilling life, and I really wish that for her. Now, one of the things that she struggled with is lymphedema, and there are some people who have such severe lymphedema that there are huge masses that can literally hang from their legs. Take a peek at this video right up here with a woman from My 600 Pound Life who is dealing with just that. And remember, eat real food, use clean skincare, and auto-rejuvenate before you operate.